The biggest problems in pediatric ophthalmology, and the most common ones, are amblyopia and strabismus. So the common name for amblyopia is lazy eye. So some of the signs and symptoms of lazy eye that you might notice are crossing or drifting of the eyes. And that leads into strabismus, where there's actually a misalignment of the eyes. And in those cases, the kids oftentimes will suppress the vision from one eye to avoid seeing double. And so in those cases, we start to worry about the child preferring one eye over the other, which leads to a lazy eye. Sometimes you may not be able to recognize that the vision in one eye is decreased compared to the other, especially if they're not drifting or crossing one eye. So an important part of eye care is vision screening. So a lot of the times we rely on our pediatricians and our school systems to do the initial vision screening for these young children. A lot of parents tell me, oh, I'm worried that, my daughter or my son can't see very well because I see them squinting a lot, and I see them holding their reading material very close or standing very close to the TV to watch. Those are some indicators that maybe their child is having a little bit of problems with the vision. But squinting actually could also be an indicator of strabismus or crossing or drifting eyes. And oftentimes we see kids squint, especially in bright light, because it causes the drifting to come out. And when they do have one eye drifting or crossing, sometimes they do get double vision and they'll squint in response to that. I think a lot of questions that I get from parents have to do with photographs. So a lot of parents will say to me, well, I noticed that in a lot of pictures that I take of my daughter or my son, that their eyes look crossed or they look like they're not really looking or paying attention. If that does happen, I think it's one thing definitely to note. Bring a picture in to show your eye care specialist or to show your pediatrician, and they can tell you, yes, I think you need to have a full eye exam to pursue this further.